Are you struggling to control your blood sugar levels with type 2 diabetes? Actos and Byetta are two popular medications that aim to help manage your condition, but which one is more effective in controlling sugar? In this video, we will compare Actos and Byetta to help you make an informed decision about your treatment options. Overview of Actos and Byetta as treatment options for type 2 diabetes. Actos, also known as pioglitazone, is a medication from the thiazolidinedione class. It works by increasing the body's sensitivity to insulin, allowing for better regulation of blood sugar levels. Byetta, on the other hand, is a type of drug called a glucagon-like peptide-1 receptor agonist, GLP-1 It stimulates the release of insulin, leading to lower blood sugar levels. Both Actos and Byetta are commonly prescribed for type 2 diabetes, but they work in different ways. Actos helps improve insulin sensitivity, while Byetta increases insulin production. Understanding how each medication works can give you a better idea of their effectiveness in controlling blood sugar levels. How Actos works in controlling blood sugar levels. Actos, or pioglitazone, is a medication that helps control blood sugar levels by increasing insulin sensitivity. It works by targeting the body's cells, specifically the adipose tissue, muscle, and liver cells. When Actos is taken, it binds to a receptor called peroxisome proliferator activated receptor gamma, PPAR-gamma, which is found in these cells. When Actos binds to the PPAR-gamma receptor, it activates certain genes involved in glucose metabolism. This activation leads to increased insulin sensitivity, allowing the body's cells to better respond to insulin and utilize glucose. As a result, blood sugar levels can be better controlled, reducing the risk of hyperglycemia. Actos is typically taken once daily and can be used as monotherapy or in combination with other diabetes medications. It is important to note that Actos is not recommended for individuals with heart failure or a history of bladder cancer. How Byetta works in controlling blood sugar levels. Byetta, or exenatide, is a medication that helps control blood sugar levels by stimulating the release of insulin. It belongs to a class of drugs called glucagon-like peptide-1 receptor agonists, GLP-1. GLP-1 is a hormone naturally produced in the body that helps regulate blood sugar levels. When Byetta is injected, it mimics the action of GLP-1 by binding to GLP-1 receptors on pancreatic beta cells. This binding stimulates the release of insulin, helping to lower blood sugar levels. Byetta also slows down the emptying of the stomach, which can help regulate post-meal blood sugar spikes. Byetta is typically taken twice daily before meals and can be used as monotherapy or in combination with other diabetes medications. It is important to note that Byetta is not recommended for individuals with a history of pancreatitis or severe kidney problems. Effectiveness of Actos in controlling blood sugar levels. Actos has been shown to be effective in controlling blood sugar levels in individuals with type 2 diabetes. Clinical studies have demonstrated that Actos can significantly reduce HbA1c levels, which is a measure of average blood sugar levels over a 3-month period. In a study published in the New England Journal of Medicine, researchers found that Actos monotherapy resulted in a mean reduction in HbA1c levels of 1.5% after 26 weeks of treatment. When used in combination with other diabetes medications, Actos has also been shown to provide additional glycemic control. It is important to note that the effectiveness of Actos can vary between individuals. Factors such as the severity of diabetes, overall health, and adherence to treatment can influence the response to Actos. Regular monitoring of blood sugar levels and discussions with a healthcare provider are essential to determine the effectiveness of Actos in individual cases. Effectiveness of Byetta in controlling blood sugar levels. Byetta has also been shown to be effective in controlling blood sugar levels in individuals with type 2 diabetes. Clinical studies have demonstrated that Byetta can significantly reduce HbA1c levels, similar to Actos. In a study published in Diabetes Care, researchers found that Byetta monotherapy resulted in a mean reduction in HbA1c levels of 0.7% after 30 weeks of treatment. When used in combination with other diabetes medications, Byetta has also been shown to provide additional glycemic control. Like Actos, the effectiveness of Byetta can vary between individuals. Factors such as the severity of diabetes, overall health, and adherence to treatment can influence the response to Byetta. Regular monitoring of blood sugar levels and discussions with a healthcare provider are essential to determine the effectiveness of Byetta in individual cases. Side effects and safety considerations of Actos. As with any medication, Actos is associated with potential side effects and safety considerations. Common side effects of Actos include weight gain, edema, fluid retention, and increased risk of fractures. It is also important to note that Actos has been associated with an increased risk of heart failure, especially in individuals with pre-existing heart conditions. Additionally, Actos has been linked to an increased risk of bladder cancer. This risk appears to be higher in individuals who have been taking Actos for longer durations or at higher doses. It is important to discuss these potential risks with a healthcare provider before starting Actos. Side effects and safety considerations of Byetta. Byetta is also associated with potential side effects and safety considerations. Common side effects of Byetta include nausea, vomiting, and diarrhea. These side effects are usually mild and tend to improve over time. In rare cases, Byetta can cause severe hypoglycemia, low blood sugar, when used in combination with other diabetes medications that increase the risk of hypoglycemia. It is important to be aware of the signs and symptoms of hypoglycemia and to follow a healthcare provider's guidance on adjusting medication doses to prevent low blood sugar. Byetta has been associated with a slightly increased risk of pancreatitis, a condition characterized by inflammation of the pancreas. It is important to discuss this potential risk with a healthcare provider before starting Byetta, especially if there is a history of pancreatitis or other risk factors. Comparing Actos and Byetta in terms of efficacy, side effects, and cost. When comparing Actos and Byetta, it is important to consider their efficacy in controlling blood sugar levels, as well as their potential side effects and cost. In terms of efficacy, both Actos and Byetta have been shown to effectively lower HbA1c levels in individuals with type 2 diabetes. However, the specific reduction in HbA1c can vary between individuals and may depend on factors such as the severity of diabetes and adherence to treatment. When it comes to side effects, Actos is associated with a higher risk of heart failure and bladder cancer, while Byetta has a higher risk of nausea, vomiting, and diarrhea. It is important to discuss these potential side effects with a healthcare provider and weigh the risks and benefits before choosing a medication. Cost can also be a factor in the decision-making process. Actos is available as a generic medication, which may make it more affordable for some individuals. Byetta, on the other hand, is a brand name medication and may be more expensive. Ultimately, the choice between Actos and Byetta should be made in consultation with a healthcare provider. They can assess individual needs, consider factors such as overall health, medication preferences, and potential interactions with other drugs, and help determine which medication is the best fit for diabetes management. Conclusion and recommendations for choosing between Actos and Byetta. Actos and Byetta are both popular medications used to control blood sugar levels in individuals with type 2 diabetes. Actos works by increasing insulin sensitivity, while Byetta stimulates insulin release. Both medications have been shown to effectively lower HbA1c levels, but their specific efficacy and side effects can vary between individuals. When deciding between Actos and Byetta, it is important to consider factors such as overall health, medication preferences, potential side effects, and cost. It is recommended to have open discussions with a healthcare provider to determine the most suitable medication for individual diabetes management. Remember, effective blood sugar control is crucial in managing type 2 diabetes. Regular monitoring, healthy lifestyle choices, and adherence to prescribed medications are essential for optimal diabetes management.